NCLEX RN practice test online free. Question 1. Set 1. A patient on chemotherapy has a platelet count of 20,000. What is the nurse's priority? Infection control, bleeding precautions, managing nausea, increasing protein intake. Thrombocytopenia, low platelets, puts the patient at high risk for bleeding. Question 2. Set 2. What is the purpose of administering magnesium sulfate to a preeclamptic patient? To lower blood pressure, to prevent seizures, to induce labor, to increase fetal lung maturity. Magnesium sulfate is the drug of choice for seizure prophylaxis in preeclampsia/eclampsia. Question 3. Set 3. What is the primary goal of care for a patient with Alzheimer's disease? Curing the disease, maintaining safety and function, improving memory, teaching new skills. Management focuses on safety, nutrition, and maintaining the highest level of function possible. Question 4. Set 4. Which condition is characterized by current jelly, stools, celiac disease, intussusception, Hirschsprung's disease, Crohn's disease? Intussusception causes stools mixed with blood and mucus, appearing like currant jelly. Question 5. Set 5. What does alopecia mean? Loss of appetite, loss of hair, loss of hearing, loss of skin pigmentation. Alopecia is the medical term for hair loss. Question 6. Set 6. Which fetal heart rate pattern is most concerning? Early decelerations, late decelerations, accelerations, moderate variability. Late decelerations indicate uteroplacental insufficiency and are non-reassuring. Question 7. Set 7. HbA1c levels reflect glucose control over what period? 24 hours, 1 week, 3 months, 1 year. HbA1c measures the percentage of glycated hemoglobin over the 120-day lifespan of red blood cells. Question 8. Set 8. What is the primary purpose of pursed lip breathing? To increase heart rate, to keep airways open longer and promote CO2 excretion, to decrease oxygen consumption, to strengthen the diaphragm. Pursed lip breathing prevents airway collapse during expiration. Question 9. Set 9. A patient with COPD is receiving oxygen. Why should the nurse maintain the flow rate at 1 to 2 L/min? To prevent oxygen toxicity, to avoid suppressing the hypoxic drive, to prevent dry mucous membranes, to save cost. Patients with chronic hypercapnia rely on low oxygen levels to stimulate breathing. Question 10. Set 10. What is the therapeutic level for lithium? 0.1 to 0.5 milliequivalent/L, 0.6 to 1.2 milliequivalent/L, 1.5 to 2.5 milliequivalent/L, 3.0 to 4.0 milliequivalent/L. The maintenance therapeutic range for lithium is 0.6 to 1.2 milliequivalent/L. Question 11. Set 11. A patient has a suspected fracture. What is the first priority? Administer pain medication, immobilize the limb, apply ice, obtain an X-ray. Immobilization prevents further tissue damage and reduces pain. Question 12. Set 12. What are the 3 P's of diabetes mellitus? Pain, pallor, pulselessness, polyuria, polydipsia, polyphagia, poverty, pollution, population, pressure, paresthesia, paralysis. Excessive urination, thirst, and hunger are classic signs of hyperglycemia. Question 13. Set 13. A patient with type 1 diabetes is shaky and sweaty. What should the nurse do first? Administer insulin, check the blood glucose level, give 15 g of simple carbohydrates, notify the provider. Assessment of blood glucose is the first step when hypoglycemia is suspected. Question 14. Set 14. Which is the correct order of the nursing process? Planning, assessment, diagnosis, implementation, evaluation. Assessment, diagnosis, planning, implementation, evaluation. Diagnosis, assessment, implementation, planning, evaluation. Evaluation, implementation, planning, diagnosis, assessment. ADPI assessment, diagnosis, planning, implementation, evaluation. Question 15. Set 15. A child is admitted with tetralogy of Fallot. Which position helps during a tet spell? Supine, knee chest position, prone, side lying. Knee chest position increases systemic vascular resistance and improves oxygenation during cyanotic spells. Question 16. Set 16. Which position is best for a patient receiving a tube feeding? Prone, supine, high Fowler's, left lateral. High Fowler's position prevents aspiration during enteral feeding. Question 17. Set 17. A client has a chest tube. The nurse notes continuous bubbling in the water seal chamber. What does this indicate? Normal function. An air leak. The lung has expanded. The tube is occluded. Continuous bubbling in the water seal chamber indicates a leak in the system. Question 18. Set 18. What is a major safety risk for toddlers? Sports injuries, poisoning and drowning, occupational hazards, elder abuse. Toddlers are at high risk for accidental poisoning and drowning due to their curiosity and mobility. Question 19. Set 19. A patient is scheduled for surgery. When should the consent be signed? In the OR, after the sedative is given, before any preoperative medications are administered, in the recovery room. Consent must be signed while the patient is alert and not under the influence of mind-altering drugs. Question 20. Set 20. A patient is hearing voices that say, "Kill yourself." What should the nurse ask first? How long have you heard these voices? Do you have a plan to carry this out? Why do you think the voices say that? Would you like some medication? Assessing for safety and a specific suicide plan is the priority when a patient reports command hallucinations.